Hello everyone, welcome in. In this video we will be discussing two very important witness interviews. A small disclaimer since the judge has not decided on the evidence yet, but because of the research that we've put in, I'm pretty confident to say that these witness statements will be allowed in as evidence since they're speaking about instances after the alleged crime took place, not all the care that Alexee got before the alleged crime took place, which I feel is really the only issue that the judge could be finding for inadmissibility right now. But I do feel confident that these statements will be allowed in, and if for some reason we do get word that they are not, then I will update and let everyone know how that could negatively affect this case. But for now, these are two very important statements as they fill in the gaps of time missing from body cam and hallway video, as well as solidify certain lies Alexee told in regards to being a virgin once it was undeniable, which basically just destroys the defense's case. So let's get right into it.
So this is Lorraine.
Hi, Lorraine.
Hi. I'll let you guys do this today.
Jim is here.
I'll let you do this.
Sorry. Go ahead and see.
Can I sit right here?
Yes, ma'am. First of all, you're not in trouble in any ways.
No, it's just reliving
I'm sorry about that.
Yes.
episode, but yeah. That's what it is.
I apologize for that. So can you just tell us everything from the beginning of your contact on the January 27th, either the day it happened, with either party, the mom or the baby, whichever one came first, and then to the end of contact with either?
Okay.
Oh, but can I start with your full name?
Lorraine Romero.
Lorraine Romero? All right. Okay, and so can you start from the beginning for me?
Okay, so because I do 24/7 call for ultrasound, so I got a call. I couldn't even tell you the time. Maybe it was 8:30, 9 o'clock.
At night?
Mm-hmm.
Okay.
Mm-hmm.
So right off the bat, she seems very sympathetic. She gives off kind of quiet grandmother kind of vibes. She also seems slightly no-nonsense, but not in a harsh way, more in a soft kind of way. She clearly has the wrong time for the incident, which is not enough to fully impeach her as a witness, but it could allow the defense to try and question how well she remembers the rest of the incident. It would be up to the state to recover from there and ultimately up to the jury to decide if a few inconsistencies like time or whatever are enough to not believe the rest of her testimony or her statements in this video. However, they decide to present this in court. Okay, continue.
So I come in and they asked me to come in for a stat ultrasound. Apparently the patient had delivered the baby and thought that there was still placental tissue because the amount of bleeding she was having. So I thought, okay, great, I'll be right there. So when I got here, I go and I get my ultrasound machine. I go directly to the ER. And first of all, when I came to the hospital, I noticed that there were about 6 cop cars. Okay, so I thought, oh, please don't let it be my patient. But anyway, so I get my machine, I go directly to the ER department, and I said, where's the room that I'm supposed to go into? And they said room 2. So I'm taking my machine over to the room, and there's 2 cops in front of the door, and there's 2 police officers inside the room that the patient was in. So I'm getting ready to go in. It was a little bit of chaos because there's quite a few. The nurses were around. The physician, the ER doctor, was sitting at her desk, and 2 ER nurses stopped me and said, "You do not need to do the ultrasound. You could go ahead and leave." I thought, that's fine. Grabbed my machine, started to head back to my department, and then the physician, I can't even remember who the ER doctor was. I can't remember her name. But anyway, she said, "Lorraine, do me a favor." And her hands were covering her face, and I saw that she was distraught. And I said, "What can I do? What's wrong?" And she said, "I really do need for you to go in and do the ultrasound." And I said, "Okay, that's fine." And we're still looking at the same diagnosis. And she mentioned to me, she said, "No, this is disturbing." She pulled me aside. She was whispering to me, and she said, apparently what the patient did was she walked in, she goes to the restroom and delivers the baby in the restroom, and then puts the baby in a bag, because the garbage that we have throughout the departments are pretty tall, and there's those large garbage bags that are pretty sturdy. So I guess she delivers it in the bathroom and pulls placenta and everything out, throws the baby in the bag, goes in the garbage. And how she ended up in the room for me to scan her, I have no idea. I didn't get details.
No, that's fine. Just what you did.
Okay, this is interesting because the defense has said that the hospital had no urgency to treat Alexee. They all but ignored her, basically, is how he's put it. They were doing nothing in regards to Alexee's pregnancy, but this tells another story. If you slow down what she's saying, once Alexee came out of the bathroom and there was blood everywhere, that coupled with the positive pregnancy test and the weird HCG qualitative results, the doctor assumed that this was a miscarriage, right? It would make the most sense because the hospital had no reason to believe anyone would give birth and discard a fully developed baby. You'd obviously be thinking miscarriage. The fact that the ultrasound tech shows up for a miscarriage shows that the hospital was trying to do everything they could for Alexee, not just ignoring everything. Even after the hospital found the baby, the doctor asked the ultrasound tech to still help Alexee and examine her. They're not acting like maliciously or negligent in any way. So I think that helps the state a lot, and also possibly in the civil case too.
So anyway, so I go into the room with her, and I know that I need to scan her, but I need to scan her through the vagina, not through the belly, because I noticed that there was a significant amount of blood on the table. And there was a police officer in there, and I was a little bit uncomfortable with him being there, and so was she, so I asked him if he could step out.
This is what benefits the state greatly here, because the police are removed from the room. Alexee begins to speak freely. Simply because there is no longer body cams running or cops to hear what she's saying, Alexee starts making really interesting statements and asking odd questions, in my opinion, because she is, number one, scared, and number two, trying to alibi herself and get people on her side, it seems.
So I didn't want to have a conversation with her after I was given this information, but she was talking to me, and while I'm trying to get things set up, and she says, I don't know what's going on. She said, I didn't know I was pregnant. I'm a cheerleader. I started gaining a lot of weight. My clothes were tight. I was taking birth control pills. So she said this didn't make any sense to me. I don't know what to tell you. Yeah.
I'm a cheerleader. I started gaining a lot of weight. My clothes were tight. Let's start with this first. That could allow the state to bring in the photos of Alexee in her cheer outfit, where she clearly looks pregnant, as evidence to corroborate these witness statements, and those photos are extremely damning. Secondly, this will allow the state to show the jury that Alexee knew she was gaining weight, and also be able to ask an expert or even the medical workers who were there that night, because you would assume them to have some kind of knowledge, that if someone is gaining weight to the point that their clothes don't fit while working out constantly as a cheerleader, and as we find out soon, taking diet pills, wouldn't one of the logical things a woman of childbearing age would question would be pregnancy? Anyways, let's just continue from there.
And that was the end of your contact with her? Mm-hmm. Okay. Other than her telling you that she was pregnant, taking birth control, and her clothes got tighter, did she tell you anything else that may come to mind?
And did you use the belly ultrasound or the vaginal?
Through the vagina.
Through the vagina.
Yeah, and still there was, some tissue, because when you deliver, whether it's a normal delivery or not, sometimes still placenta tissue can still be in there. Mm-hmm. And so she was having a significant amount of bleeding. But after that, I stopped, I told the doctor, and I sent the report out to be read, and that was it. So it wasn't till the morning, too, when I walked in, and this is Artesia. I'm not from Artesia. I just work here during the week, and word gets around, and I just was hearing stories of what really happened. I never knew the details until I walked in the next day. Okay. And I just didn't say anything.
And how long have you been a
ultrasound
tech?
For about 20 years.
Okay. So, is there any other trauma or anything to that part of the body that would lead you to believe that she didn't give birth, or?
You will hear the detectives ask this in basically every interview because at this time they essentially needed to prove that there was a baby in the bathroom and that Alexee was the one who put him there via birth and concealment. And in court that will be established rather quickly, and the issue will be, did the baby breathe or not? So I just wanted to point out that at this time what the detectives needed to do was just point the finger at Alexee. So that's why you'll hear, when we go through all these interviews, you'll hear that asked over and over again.
No, because, and after talking to the ER doctor, I mean, she was obviously in labor, and I think she knew that. And so my assumption was, she panics because when she was talking to me, she was talking pretty rapid, and she was like, I don't understand. So, was it all mental, psychological, who knows, but she definitely knew what she was doing, and what was doing was wrong because of the way she was talking to me, just stating, I didn't realize I was pregnant, and, but I'm taking the birth control, so, I mean, she was panicked, but, I didn't see her being in a state of mind where she did not know what she was doing. And that's just my perception working with women, well, not just women and men, and scanning in general, who's a little bit off, and I didn't get that with her. She was pretty much...
So this is a great statement because when you think about the defense, Gary has not claimed insanity by any means. He's tried to blame postpartum hormones and morphine at the most, but that doesn't rise to the level of insanity, right? So he's kind of forced to drop that argument, or it will be very incongruent in the jury's heads. This is really interesting testimony because it's from this woman's perspective, but she seems credible despite not remembering the time of night this happened 3 months prior to this interview. She would be considered credible by the jury, in my opinion. So her opinion and perspective matter. And to her, it seemed like Alexee was trying to alibi herself, and that Alexee's state of mind was not insane, so to speak, but rather so aware of the circumstances that she was attempting to build sympathy and alibi herself to others. That is very powerful, because should this woman have said something else, something like, Alexee was crying the whole time, Alexee said she could not believe that the baby wasn't alive, and she was so sad and panicked, and she did something wrong, and now she feels horrible, now that would cause sympathy with the jury. Because maybe you would think as a jury, oh man, maybe the baby did come out and appeared to be dead. Maybe Alexee knew she was pregnant but didn't want to deal with her mom for 9 months, so she figured for some reason we'll just deal with it once the baby's here, and then when the baby came out dead, she panicked and threw him away. We don't want that kind of doubt going into the jury's head. So this statement being made rather than any other kind of statement is so powerful because it shows that Alexee completely disregarded the fact that a baby was born or anything and was attempting to alibi herself. Whether this is repeated on the stand or played as video or read off a transcript, however this is used in court, it will be very damaging to Alexee's case.
And she felt it. I mean, you could tell that she was, I don't know if I should say if she was worried or she was concerned because she knew what she did was in the wrong. That was just the impression I got from her.
Is there anything that we didn't ask that you think we should know about?
I don't think so.
Okay.
Yeah.
Those are some great final words from this witness, and now we will move on from here and get into the RN who treats Alexee after she exits the bathroom. Immediately, we're going to get into very important statements made by her, so let's get into it.
Hey, sorry I'm late.
No, it's okay.
I'm looking for you guys everywhere.
No big deal.
All right.
All right, thank you, ma'am.
You're welcome. How you guys
Good, how are you?
Good.
Coming into work?
doing? Yeah.
Okay, and are you Elizabeth Crawford?
Yes.
Detective Gonzalez.
Nice to meet
Jim
you.
Minter, nice to meet you.
All right.
You're not in trouble.
I know.
Okay.
We just want to start that off with all the
Real quick, just because we'll do this for each person who's a witness, we must observe them and how they come off, because juries have their own perception of people just based off who they are, right? So I feel like she comes off caring since she's worried about being late for them. She's personable, she's innocent because she laughs and is not nervous in the presence of detectives, although you will see her change a bit of her demeanor. She becomes a bit smaller and more quiet when she's talking about the incident, which shows she's taking it seriously. And juries are very, very perceptive. They pick up on all of these kinds of things about people, so that's why I mention it. Okay, let's continue.
The interviews.
So if you could you just tell us everything from your contact on January 27th with either the patient or the child, any contact you had from beginning to end?
I didn't have much contact with her until she exited the restroom. I didn't take care of her before that, but
So the
after
patient.
that, I took care of her. Yeah.
Okay, can you tell us what happened?
So she came out of the restroom.
Mhm.
There was a little trail of blood from the bathroom back to her room. We went to her room. I went to get her undressed. The doctor came in, explained to her that she had a miscarriage. Her and her mom had a back and forth about it.
The doctor.
Okay, just to pause right off the bat, this may be what Rosa is talking about when she says this.
I'm sorry. Alexee, I told you about this. I just asked you, baby, to tell me the truth. It was not.
Because finally, with the doctor in the room at that point, the denial of pregnancy of any kind is officially up. But as you'll hear from this RN, she expands later, but the detectives kind of let her walk through everything right now and then get back to it in more detail. But she will explain how there was a denial of pregnancy at some point. So let's continue.
The doctor said she had a miscarriage?
Yeah.
Okay.
She said it seems essentially like, I'm not sure the exact words, so it was a few months ago, but she said, it seems that you've suffered from a miscarriage, which didn't seem totally abnormal. It seemed awful miscarriages before they were very bloody.
Right.
And so.
Was she bloody?
Mm-hmm.
Like
And then there
her
was,
legs? And
yeah, she had blood all down her legs, and then there was like blood in the bathroom everywhere, so.
Okay, and you saw that?
Mm-hmm.
Okay.
And then got her in the bed, got her in a gown, helped her clean up. Doc came in, we did the pelvic, essentially, and then HT had come in and took the doctor away, and then I helped her get back in the bed, get her comfortable. I went to go get her blankets, and that's where the baby itself was in that room where the blankets are. So then I went back in there and essentially just took care of her tried to as a postpartum patient from then on.
Right.
That's about it. After that, we had ultrasound come in to essentially make sure there's no products of conception left in there. I think they booted the mom somewhat after the pelvic exam was done.
Were you in there when let's go back.
Okay.
You said you saw blood in the bathroom. Where did you see that?
It was just on the floor, with white marks.
Okay.
Essentially, she had tried to wipe it up.
Was it on the toilet? Was it in the? Where exactly was the blood and how much?
It was a good amount. It was on the floor, essentially.
Okay.
So I don't remember seeing any a lot on the toilet or anything like that.
Okay. So when you came into the room, did she say anything? Did you say anything to her?
Once we all figured out what was going on and I went in there, she essentially was scared. She was worried that she was going to get in trouble. She did have the back and forth with her mother that was just about they had said, the mom was upset because she had had sex and hadn't told her. So they were going back and forth on that, and then she was just denying it, which was a little wasn't really deniable at that point in time.
Right.
So the patient was denying having sex at this point to her mom.
Yeah, she was trying to state that she was still a virgin.
After she came in from the bathroom and all the blood and all that. Okay.
So this right here is huge because there are some inconsistencies and some issues with hearsay on some of the other witness statements about Alexee saying she was a virgin and all of that, mainly with the best witness, in my opinion, who's HT, because he never actually saw or heard Alexee say anything about it. It's all like third-party statements related to him. So this statement here is huge since this person was actually privy to an exact conversation where Alexee denies her pregnancy. Why? Because the state can say if Alexee was so willing to hide her pregnancy, even then, after literally having given birth in the bathroom, what makes you think she didn't hide it all along? I would be shocked if something like that is not said in the state's closing arguments, that Alexee was so privy to hiding it even then, that how can we believe she didn't know the whole time? Even if we never get solid proof that she did know the whole time, all these little things really make it stick in the jury's head that, yeah, there's no way this chick didn't know, right? Okay, continue.
So, did the pelvic, and then I think shortly after that, the mom was in the waiting room after that. And then she was just worried. She was asking me, like, what was going to happen. I told her, obviously, I did not know.
Is this when you found out she was worried about getting in trouble? Did she tell you anything, like?
She didn't say anything about what had happened. She was just essentially worried that she was just going to get in trouble.
So that's what I mean. Were those the questions she was asking?
Like what's going to happen to me? Like that kind of thing.
Did she ever ask about the baby?
No.
Not once.
If I was the state, I would play this clip a few times just to let it sink in for the jury. The detective who asks about the baby after this RN is explaining how much Alexee cared about getting in trouble and about herself, but not the baby, is very great for the state's case. As sad as it is, it sums up Alexee's thought process so clearly, and that is one of selfishness and self-preservation this whole time, in my opinion.
And so her focus was her getting in trouble, and anything other than that she talked to you about?
She did at one point in time when the ultrasound tech was in the room with her ask if there was anything. She pretty much said, would there be any like bad outcomes if she had stopped taking one medication and stopped taking another? And I said, well, what medications are you talking about? She said, well, what would happen if I stopped taking birth control and started taking weight loss medications? And I was like, I don't know.
It's an odd question.
I thought so.
So this is one of the things I see people discussing a lot, like on Reddit and other places, as an indicator that Alexee knew she was pregnant. If the jury is able to make that connection in their minds, great. If not, this is one issue that Gary may try to use as a way to say Alexee thought the birth control is what was making her gain weight, so she stopped taking it and started taking diet pills. But that logic ends when you realize Alexee never once questioned if pregnancy could be one of the reasons for her gaining weight, right? That in and of itself is suspicious, because anyone who is not trying to hide, deny, or conceal their pregnancy would consider it a possibility despite having used birth control. Once the weight keeps coming on and the diet pills aren't stopping it, a logical woman who's had intercourse would question if she was pregnant, no matter if she's had periods or any of that. The fact that Alexee never once questioned if she could be pregnant is hard to believe, and it reeks of a lie to the jury. So people are keen to focus in on that point. It will be very, very important for the state to lay out in clear logic why this indicates Alexee knew she was pregnant.
And how long have you been in RN?
9 years, almost 10.
And you live here in Artesia?
In Carlsbad.
In Carlsbad?
So you got her the blankets. After that, what did you do? Did you have any more contact with the patient?
Yeah, I just popped in periodically and like checked the amount of bleeding, make sure she wasn't like hemorrhaging or anything.
Okay. And then, so until she left, is that what you did? Did you do anything else other than checking on her, make sure she was okay?
Just that.
Did you participate in the pelvic exam?
Yeah, I was in the room.
Okay. Were you able to see, did it appear that she gave birth based on the pelvic exam in your experience?
Would you be able to tell?
Yeah.
No.
No,
Okay.
you weren't. You weren't, okay,
So I've never done OB, so
okay.
what a pelvic exam looks like after birth, I have no idea. I could say that there was a lot of blood, more than normal, like in a normal pelvic exam, obviously.
Right.
Like we tried to get the suction working because there was so much blood that it wouldn't work, that kind of thing.
Right.
So,
So the blood is very interesting to me because we do not know how much Alexee was able to clean up and flush. But if you are inclined, you can find the photo of the bloody bathroom online and try to assess for yourself how much blood you think is left in that bathroom. From some research, I found that women lose between a half quart to a full quart of blood during birth. I do not know how much blood was left over or how much blood was lost in total, but I have a feeling the defense will use this as a way to say that Alexee had a stillbirth, because again, they need to disprove that the baby was alive as well. So I think all the blood could be a way to cause even maybe a shred of doubt for someone as to it being a bad birthing experience to some degree and a stillbirth ultimately. Now, if you remember back to the Ultrasound Tech interview, she said that she had thought Alexee ripped the placenta out, which according to my research could be a cause for the excessive bleeding, because as the placenta detaches from the stomach, and when it comes out on its own in a typical fashion, the blood vessels that keep it attached start to close up as well. So let's say if Alexee did rip out the placenta before the body was doing its own process of closing it up, those blood vessels could have been bleeding because they were not told by the body to close, so to speak. Okay, I just felt like that's important to note here because there will be a lot of medical testimony in this.
Okay. So, after she left, did you do anything else? Have any other contact? And so that was just your side of it? That's everything you did?
yeah.
Okay. Is there anything we haven't asked as of yet that you think we should know about?
Nothing that I think of.
Okay.
The only thing was just those medications that she was asking about. That was weird.
Just what would happen if you stopped birth control, started weight loss?
Mhm.
And she didn't expand on that? She didn't tell you why she was thinking that?
No, it seemed obvious in my head though, so.
Could you tell me why it seemed obvious?
Well, it seemed like she'd been trying to hide this pregnancy from her mother for some time.
Mhm.
So if you know you're pregnant, you're not going to continue taking birth control pills. But if you're trying to hide it, you might start taking weight loss medications. That's just kind of what it seemed like in my head.
Okay. Just want to make...
So like I said earlier, the state will need to put this logic forward plainly, and Ms. RN did it great here. She explained exactly why she thought that the medication switching indicate Alexee hiding her pregnancy, because even though the state doesn't have to prove that Alexee knew she was pregnant, up until the moment that baby came out of her, legally speaking, it helps bury Alexee and her defense the more people and evidence come out that Alexee most likely or definitely did know she was pregnant and tried to conceal it. I say it doesn't necessarily matter legally because if you've seen in my previous videos, I explained the intent surrounding her murder charge, and people often get that confused with premeditation, in which until the baby, really the whole case is the 18 minutes in the bathroom. That's all the state needs to convict Alexee. Should the autopsy hold up as the baby was alive, it's pretty much a slam dunk case. Everything else, like I said, just helps bury Alexee in evidence, right? It just goes to show that not only did she do this, she's completely lying about it to the jury. And if you saw my last video that was talking about the medical records and possible witness tampering and all that kind of stuff, I played a clip from a really well-respected criminal defense attorney here on YouTube, Bruce Rivers, criminal lawyer, and he talks about how if juries feel like they are being lied to, it is a very big deal, and they do not like that, and they will hold that against you.
Sure, because it seems like it to me, so just want to make sure I'm not thinking...
And was the argument between her and her mom pretty heated?
I wouldn't say heated. It was awkward.
Awkward?
Yeah. They were going back and forth, and her mom was definitely angry.
And patient is 19.
Mm-hmm.
Mom is quite a bit older.
Mm-hmm.
Gotcha.
And they never once asked about the baby? During the entire time you had contact with her, once she left the bathroom? Even after they found out that the baby was found and all that, they never asked anything about the baby?
I did go, now that I think about it, I did go check on the mom just to give her an update. And I think she asked about the situation, like asked what was going on. But I told her I couldn't tell her anything. So I just went to go tell her that like she's being transferred to Roswell.
Right.
And give her an update on her daughter essentially. And that she asked about like what was going on with all of that. She said, like, what happened to the bathroom? What happened to the bathroom? I said, I can't tell you.
Right. But nothing specific saying,
That's
what about the baby?
correct.
Okay, I don't.
Okay, so that is basically it for these two witnesses. Like I said in the beginning, if the judge comes back with some kind of off-the-wall decision and none of this testimony or witness statements are allowed in, then I will obviously have to update this because that would be absolutely tragic for the state, because this is all very great testimony. Like I said earlier, we know that basically everything rests in the autopsy and the person who's trying to disprove it. I have a video on Chris Sperry, the expert witness, who is tasked with disproving that this baby took a breath. If you are very, fond, if you've been following this case, you've probably seen some of the medical examiners who have been on like court TV and whatnot talking about this autopsy and the findings, and they say that number one, this is a strong autopsy, number two, that no self-respected medical examiner or expert would want to put their name behind trying to disprove this autopsy, because obviously that's just rubbish and like junk science. So if you do want to take a look at the person who is tasked with that, there is a video on him. At some point I'm going to go through his testimony in the Rosenbaum trial that is here available on YouTube, and I'll make a video where we just kind of react to it, because he results in guilty verdicts, because it is very clear that he is lying and dismissing the truth. And the Rosenbaum trial is a very good comparison, because basically the prosecutor in that case was so ready and educated about the medical issues that were going to come up, and that Chris Sperry was going to try and deny for the defense. And this man, this amazing prosecutor was on it. He almost was like a part doctor, part lawyer. He was crushing it. And in this case, all these witness testimony and witness statements, they are basically helping us show what Alexee did that night, helping us, like with Rosa as one of the witnesses, walk things back as far as we can within the scope for the case. And then when it comes to the medical experts, that is the hinge of this case, in the fact that we have to prove that the baby was alive, otherwise the murder charge will not stand. Now, everything seems to indicate that baby Alex was born alive. The only people who are adamant about that are the ones who have been messing with the facts and the reality of this case since the beginning, right? The people on the side of the defense. So when it comes to the medical testimony, we will look deeper into that, but we have to remember that these witness testimonies are very effective as well, even if they're not proving if the baby was alive or not, which is what hinges for the murder case. They are building they're painting a picture for the jury as to who Alexee was at this time, what she was doing at this time, how she was thinking, how she was acting, and all of those things mixed with having found the baby in the trash in the bathroom show that this was a pretty deliberate and intentional act, one of an attempt to deny, conceal, and hide this pregnancy by any means necessary, which included allegedly killing the baby. So this is the witness statements are a big deal, as well as the quote-unquote, what I think Vinny from Court TV said was going to be the battle of the experts, right? I really don't think it's going to be a very equal battle. This Chris Sperry guy is a joke, in my opinion. And so these witness statements help a whole lot, just painting the picture of who Alexee is, what she cared about, what she was trying to do. And these two witness statements, the Ultrasound Tech and the RN, are vital, because Alexee started opening her mouth after she first blabbed when the police come into the room and kind of basically admits to the tampering with evidence charge on body cam. She shuts up and whispers to her mom and won't be, isn't as exclamatory with her statements. But once the police leave, she starts talking again, and that will be noticed by the jury. It will be noticed that once two women are in the room alone with her, she starts trying to alibi herself and cause sympathy and say that she doesn't know. Which, one thing I'd like to point out, when Alexee's saying that my clothes wouldn't fit, I work out, I was on diet pills, all these things, but then the fact that she was still gaining weight, that is a very, for lack of a better term, stupid way to try and alibi yourself. You're halfway admitting to the fact that you should have known that something was going on medically, whether it was something wrong with your colon or something. Like, your stomach doesn't just expand for no reason unless you're drinking 47 beers a day, right? Like, let's get real. You don't have a beer belly at 19. And why is basically only your belly growing? That's really hard to deny, periods or not. And so for the jury, this all is just so detrimental. Okay, I've just been going on a little rant here at the end. Thank you so much if you've been listening this far. I will continue with more witness statements slowly but surely. I am hoping that the judge comes out with the evidence, because some of these other witness statements involve a lot of medical care, and it's going to be hard to piece through all of that unless I know exactly what the judge has decided. So slowly but surely those will come. Thank you so much if you've made it this far in this video. If you have any comments, questions, or concerns, please leave them down below and I'll get back to you as soon as possible, because I truly do enjoy the conversation. If you're interested in following this case all the way to trial, please get subscribed, because I will be covering it all along the way with a legal focus. And that's about it. It's your Girl Friday. I'll see you in the next video. Okay, bye.